This program is designed to provide general information with regards to the subject matters covered. This information is given with the understanding that neither the hosts, guests, sponsors, or station are engaged in rendering any specific and personal, medical, financial, legal, counseling, professional service, or any advice. You should seek the services of competent professionals before applying or trying any suggested ideas. Attention individuals, families, and caregivers. It's Medicare Hour and More with Peter right here on K4HD Radio. This is the podcast for all types of insurance solutions while specializing in Medicare because we Medicare. Here's your host, Peter R. Joseph.
Hey, good morning, good morning, good morning. Man, it's been a long time since I've been back on the show. A lot has happened, but I am glad to be back. We are on season 2 since we've been on hiatus for a while. Just to let you guys know, I went on an RV trip, and when I got back, broke out in some kind of weird rash, unfortunately. Got exposed to some viral thing, and was dealing with that for a few weeks. So that's why we were off the air for a while. But we are back and excited to be back. We've got a great show for you guys today. Got a couple of great guests, Craig Gussin and Johnny Alana, a realtor who's been on our show before. But before we get into that, I do have a couple of quick things I want to go over because I'm a big sports guy. And the news right now is, yes, the Dodgers got Tariq Skubal. It happened. Everyone's pissed at the Dodgers, but you know what? Honestly, and you can argue with me all you want, any owner out there could have gotten him. And if you're going to blame the lockout coming out on the Dodgers, so be it. Dodgers had the resources. They went after him. And, you want to go to a team that wants to win and wants to pay their players. And owners need to understand that. And hopefully they will learn that lesson the hard way through this next collective bargaining agreement. But yeah, even though, Dodgers got them, they're on a big losing streak, unfortunately. Hopefully they get their offense cracking and together. And my studio engineer just told me football season is just around the corner. This year has just gone by way too fast. I'm a big Rams fan, so I'm rooting for them. Super Bowl's in LA this year, so I'm hoping. We got Garrett, great defensive end, and we got Stafford again, our MVP. So we'll see what happens. But yeah, that Hall of Fame game is next week. So I'm looking forward to football season and hopefully the weather turns. It gets cooler. It's been super, super hot out here. It's been crazy, crazy hot. Well, let's see if Craig is ready to come on. He's our first guest. He's the president of California Agents and Health Insurance Professionals out here in Southern California. He's down in San Diego. Are we ready for Craig? He still got his audio issues. Craig, sometimes you have to just allow your computer to accept the audio settings. I don't know if the other only option would be the settings gear on the bottom. Oh, I thought I heard him for just a second.
I don't know why it's giving me it. Okay.
Oh, hey, I can hear you now.
Okay, it's been giving me issues every time okay, perfect.
Perfect.
Hopefully we're
hey. All right, welcome to our show, Craig. I appreciate you making the time this morning. How are you doing?
I'm doing good. You?
I'm doing well.
Good.
Hanging in there.
See you again.
Yeah, you too. I know you're gearing up for the Senior Summit coming up. When is that taking place and where's it at?
September 1st, September 3rd, Riverside Convention Center. We have actually KHIP has 5 different Medicare events going on across the state, from Fresno to Sacramento to Oakland to LA. So no matter where you live in California, there is going to be a Medicare event going on between August 20th and September 3rd. I'll be flying all over the state between those dates, attending all the meetings, and it will be great for anybody who wants to learn the latest and greatest on what's going on with Medicare, especially with, as you know, Peter, with CMS and the changes going on and the 48-hour rule and prescriptions and all this stuff. It's so important that we Medicare agents know exactly what's going to happen and how we can, how we can help our clients and what do people do. So it's going to be a fun AEP. I'm looking forward to it, but there's always going to be a lot of work. But again, there's Medicare, but also a lot of Medicare agents do IFP, do group. There's a big change coming across, possibly with Covered California. And there's a question of, can you get a subsidy if you have a green card? And there's some issues in it that we're trying to figure out. So there's a lot going on.
Wow. There's a lot. Let's unpack some of that stuff.
Okay.
So let's first look at, obviously, CMS put that final rule for 2027. Those things won't take place until October 1st. But what kind of things do you see positive happening with CMS rules for agents and beneficiaries this season?
Well, I think the biggest is the 48-hour rule, where you don't have to, client calls you up and says, can I come by today and see you? And you go, no, I can see you in 2 days. Now you can, you can see them. They scope an appointment form, you give it to them, you sign it, away you go. That's a big deal. Call recordings reduced from 10 years to 6 years. That's a big deal. You still got to keep the recordings, but at least you don't have to keep it, longer. Prescriptions,
Yeah, what's happening with that? Are they there's a new set being negotiated next year, right?
There is. Again, a lot of this stuff, I'm still waiting because things have possibly changed. So again, it's such a great reason, if you live in California, on why to, wherever you live, see when they're having a Medicare meeting, and they're going to give you the greatest and latest of what's going on. And I know they're all going to have people there talking about every aspect of it. And, that's one of the things that, I'm so proud of in our association, is how they're stepping up and really helping the Medicare agents. We're doing it in California. National Association of Insurance and Benefit Professionals are doing it nationwide, just to make sure the Medicare agent is protected. And
now,
that's the thing that I love.
So for agents that are listening in, what's a good way to support these chapters? How can we get involved?
Well, the biggest thing I can tell you is become a member. Most Medicare agents don't know, but about 15 years ago, CMS decided they were only going to pay agents for 5 years. And that was it, because they had no idea what we did. So our people went to CMS. They explained the age of the role of the agent, where they meet with the client. They see him every year. They help him during the year. And because of that, agents now will continue to get, paid forever. And the FMOs that help us weren't going to get paid. Now they do. So it's a very inexpensive way to protect your business. I look at it as, insurance to cover your job, because the National Association of Insurance and Benefit Professionals, NABIP, is working with CMS all the time. They've been talking about the 48 hours, getting rid of that, reducing the recording time, doing more and more to help the agent, to make it easier. Because when I'm in Sacramento, Washington, D.C., and I'm talking to their chief of staff, they're 24-year-old. They have no idea what Medicare is. I spend the first 10, 15 minutes explaining what is Medicare. Their answer to me is, oh yeah, my grandparents had it. But I walk them through it and I explain it to them, because they have no idea that we're spending 365 days a year helping our Medicare clients when they're in the hospital going, I don't get it. I can't find my card. I need some help. We're there to help them. And that's the role of the agent, and why it's so important now more than ever that we're there for them. People talk about, oh my goodness, AI is going to take it over. No, they're not, because AI can only do so much. It can help us, but they still need someone to talk to on the phone, reassure them, hey, we're coming up to AEP. Let's make sure your prescription plan is still the best one for you. What prescriptions are you taking? again, a lot of prescription companies aren't using agents. So we're still helping them, and, we're doing it for free.
Yeah.
The joke I always say is I stopped working for free when I moved out of my parents' house, but I'm continuing to help our clients, saying, look, we're going to take care of you. I don't really care what we get paid. It would be nice to get paid, but I'm not going to leave my 80, 90-year-old client trying to figure out what Medicare plan or what Medicare prescription is best for them. Also be aware, if you're taking a very expensive prescription, I had a Medicare client email me yesterday. They're taking Eliquis. He said it's going to cost me $1,000 a quarter. And I said to him, I work with a company where it costs you $50 a month.
Nice.
And just mail order to it. It's Canadian Pharmacy. I'm not
sure. I am aware. Yeah.
They do a great job, and I've used them for 20 years. I actually used them for my mother-in-law. That's what I found out about it years ago. So, again, if you're listening to this and you take a very expensive prescription, there's options. If you're an agent and your clients are calling you up going, I got this very expensive prescription, GoodRx. There's so many different options out there. Understand it. And this is what, CHIP or NABIP, the two associations are always talking about. Here's options available to you to lower the cost. So those are the kind of things that we're talking about. I'm talking about as a Medicare agent. I'm also talking about the president of CHIP, and just making sure that people understand that, look, Medicare, you were talking about baseball, right?
Yeah.
In the old days, Peter, the pitcher would come in, pitch eight innings, reliever come in and get closed. Today, they pitch 5.5 innings. The middle reliever comes in, maybe another reliever, then the closer. Well, health insurance is the same way. You need an expert, a Medicare agent who just got done probably doing a certification, and to help you figure out which plan is going to be best. What happened in San Diego, one of the major hospitals stopped taking Medicare Advantage plans, and we had 32,000 people saying, oh my goodness, what am I going to do? And it was literally every day I had people calling me up, 80, 90 years old, going, I was paying nothing, and you want me to pay $400 or $500 a month. What are my options? And we have these conversations and talk to them about all the options available to them and what's the best thing to do. So that's the value of using an agent. In California, it's against the law to charge to help somebody.
Right.
So just know, in California, it costs nothing to use an agent. We're here to help you. We're like the doctors in the hospitals. We get paid by the insurance companies. And a lot of times our costs are pretty much fixed. We have no control over what it is, and they pay us. And everybody's taken care of. And that's the thing that I love about it. And that's why I'm such a big believer in working with a Medicare agent or a health insurance agent if you need cover California or group health insurance, because we're there to help you.
Yeah, for sure. And Craig does a lot of great work for us. These chapters do a lot of work. They fight for us in Sacramento as well as in Washington, D.C. They meet with CMS, and they help not only beneficiaries but also agents. So I appreciate all the work that you guys are doing for us.
Thank you.
Thank you so much for that. And you just heard it here. If you want to support these chapters, you just become a member, and it's very inexpensive. Let your voice be heard. That's a great way to do that. So
and I tell everybody, if your first Medicare Advantage policy that you write, that'll pay for your dues and everything else for the year, and the rest of the year you can make money, and you've got a team behind you supporting you. And that's the thing that I look at is you have no idea. I'll give you an example. Single payer every couple of years comes up. We had a bill in Sacramento. It happened to be my personal legislator who wanted to make Medicare supplement plans open enrollment every year. And New York did that, and the rates are like double or triple what we pay in California. So you got to be very careful. It always sounds good. Free health insurance. What a great deal, Peter.
Right. Yep.
Then you start realizing, the cost of what it really is. The business owners, increase their costs. They increase, taxes and everything else to pay for it. So, you want to be aware of that. And that's what our association does. We're meeting with legislators in Sacramento, in Washington, D.C. We're telling our stories. The ACA is a perfect example. It would have been a lot worse than what it is if it wasn't for us meeting with Congress and explaining, that sounds good on paper, but it really doesn't help the consumer. This, getting rid of the subsidies.
Yeah.
I mean, I understand why they did it, but it really hurts so many people. And that's the thing that now we're going to, coming up pretty soon, November 1st, we're going to talk to people about, here's your options. We're seeing in California, the average rate increase is about 10%. San Diego is probably 3 or 4%. If you look at some other options, it's very simple. Reach out to your agent, say, okay, here's what's going on, help me. It can be Medicare Advantage plan. It can be ACA. It can be group health insurance. Just know that we're here to support you. And again, it costs nothing in California to use a health insurance agent. So that's always what I tell people every day, Peter. And I thank you so much for letting me come on. It is great to see you. I know every once in a while we run into each other. So
yeah, and I'm glad you're going to come on one more time. It's immensely helpful to our audience to hear what you're talking about, and so we appreciate you, Craig, so much. Let's kind of switch over to health insurance under 65.
Okay.
Obviously those deductibles are going up and up and up. California is like the Wild West. Unfortunately, we can't do anything to help mitigate those costs in terms of like hospital indemnity, right? It's not allowed out here. So, I mean, what are we looking at for this next year? Is it going to get worse than this last year?
Cover California said 9.9% was the average. And I know in San Diego, it was like 13. But again, if you look at some other plans, if you go, hey, I like Dr. Jones, you go, okay, fine. Let me see what network Dr. Jones is in. And I had a client last year, we did that, and her rates didn't go up at all, because we went from one plan to another and kept this price the same. And that's one of the things that we look at for our clients. So yes, I'm hearing rate increases of 10, 15, 20% due to inflation, medical costs going up, the cost of COVID and having more things needed to be done. Work with your health insurance agent. They know what's going on. We've all been looking and reading about and going to meetings and figuring out what's going to be available to us. Every insurance company is having meetings going, here's some options to consider. And again, think about your situation. Maybe you had surgery last year and you had a really rich plan. You don't maybe need that rich plan this year. So let's lower your coverage, get what you really need. If I meet somebody who's going to have a baby, yes, I want to get her to get a better plan so she pays less money out of pocket. And again, if we're talking group health insurance, then you're paying for your health insurance with pre-tax dollars. So it's better to pay pre-tax dollars to have a baby. I had a client who had twins and it cost her $3,000 for a platinum plan to have the kids.
Yeah.
Both in NICU, but she was paying with pre-tax dollars her premiums. So work with an agent. They're here to help you. Cost nothing. CHIP, or California Agent and Health Insurance Professionals. These people spend all year educating them, and I'm a big fan of it, and it's why I've been a member for like 25 years, because they do so much for me to help me to be better as an agent. And when they asked me to step up and be president, how could I say no? Because
for sure,
it's an organization I love, and we just want to be there for the consumer. And that's the organization. Our philosophy is that, and mine is, I want everybody in America to have health insurance and figure out a way to make it affordable. So that's really what you and I will be doing, Peter, for the next 3-4 months. And I really appreciate the time you're giving me today, and I'm glad you're back and glad you're feeling good.
Thank you. So we got a few minutes left. Okay. I know, you can't share a lot, but we had talked about let's go back to Medicare, and for those listening in who are about to turn 65, what are the easy steps they can take to get onto Medicare if they're about to retire or they're getting off their health insurance with their employer?
The first thing to do is if you're in California, or even if you go to national and look at National Association of Insurance and Benefit Professionals, you're going to find a link that says find an agent. You click on it. You put in your zip code. It'll give you a bunch of agents in your area. Reach out to them, talk to them, find one you're comfortable with. It's like, it's like getting a doctor. Talk to them about what you're trying to accomplish, and they're going to help you do it. So if you're 64, you're going to want to start looking at your plans. You want a Medicare Advantage plan, which is like an HMO, a limited network who you can go to. So if you like a certain hospital and they take it, it might be a great plan, and the price is going to be very small, if nothing. If you like to travel because maybe your kids live out of state, you're going to be visiting them a lot, or you're going to start traveling because you're retired, then you want a Medicare supplement plan where it's like a PPO where you can go to any doctor who takes Medicare in the country, and you have that option. And it isn't really expensive. You're probably talking a couple $100 a month.
Right.
But it'll give you the best coverage you've ever had in your life. I love Plan G because it pretty much covers everything but your yearly deductible, which is,
I think it's like 280 this year. Right. Yeah. That's right.
It could be a little bit higher in 2027, but that's the most you can pay out of pocket except for prescriptions. And it's great to have. And again, once you pick a Medicare Advantage plan after 12 months, you can't change your Medicare supplement unless you go through underwriting. But again, you can pick a Medicare supplement, and maybe when you're 80, 82, 83, say, okay, I'm not traveling as much. I'm going to go to a Medicare Advantage plan, which is going to cost me, plans I look at is anywhere from $0 to 20, 30, 40, 50 bucks a month.
Right.
So that's really it. Again, work with an agent that sells Medicare. If they belong to the California Association of Health Underwriters, which is the California, that's the old name, California Association of Health Insurance Professionals, and then the National Association of Insurance and Benefit Professionals, which is the National Association. We changed our name about 4 or 5 years ago, and then a couple years later, NABIP changed their name over. So we do have a little bit different names, but again, we're all part of the same family. It's just a little bit. It's like when your daughter gets married, and now she changes her name, she's still a Joseph for the rest of her life.
Right. Yeah.
So we have the organizations. They support us year-round, educating us and showing us what's out there for the consumer, and that's why I'm such a big believer in them, because we need organizations that are going to help us and protect us and be there for us in Sacramento and in Washington, D.C., or in any state you're in.
Right, for sure.
Every state has different things going on, and we need to be aware of it and make sure, because everything we look at is what's best for the consumer.
Yep.
And you and I see things at times and go, that makes no sense. Why would you do that? And the reason is because some legislator's friend came to them and said, you won't believe what happened to me. And they start talking about it and go, oh, that shouldn't happen. But they don't realize the cause and effect. And those are the kind of things that we try and educate people about. People ask me every day, what do I do? I go, my job is educating consumers. Right. If I educate you, Peter, you're going to make the best decision for you. It has nothing to do with my needs, because my needs and your needs are different.
Exactly.
So think about what's best for you. If you're talking to an agent and he or she wants to do something that doesn't make sense, you have the wrong agent. Find somebody else that gets what you want and going to help you find the best plan for your needs. It's all about your needs, not mine.
For sure. Well, Craig, if people want to ask you questions or reach out to you, I know you're on LinkedIn.
Yeah.
Is there a good email address that we can reach out to?
I can, but to make it easy, you see my name up there.
Yep.
My personal one is craig.gussin@gmail. So okay. you can always use that too. And again, I'm more than happy to help you. If you live in Northern California and want to talk to somebody up there, I would tell you for Medicare, Northern California and Southern California, Medicare issues are totally different. And a lot of times I would recommend to somebody, let me get you an agent up in Northern California who knows the ins and outs, because it's different as night and day.
It
So
is. It is.
we're just here to help you. Anything I can do to help you. My phone number's up there, Craig.Gussin@gmail. And we're always here. And Peter, good to see you, and
You
probably
too,
run
my
into you
friend.
somewhere. Take
All
care.
right. Thank you so
Okay.
much. Thank
My
you. Take
pleasure.
care.
Bye-bye.
Bye-bye. All right. I appreciate Craig coming on. He's a great friend of ours. I've known him for years and years. Run into him in a lot of conferences and whatnot. So excited to have his information shared with all of you. Some pertinent information. Obviously, just kind of summarize, what a scope of appointment does. It gives us permission to talk to you beneficiaries about Medicare plans. It used to be a 48-hour rule, which means we had to have you sign a paper saying that we allowed us to talk to you, and then we could have talked to you about those benefits for 48 hours. It was just kind of absurd. I'm really glad they got rid of that rule. So now we can talk to you right away. We can also, as agents, conduct both educational events and marketing events at the same, well, not the same time, but one after the other. We don't have to split them up into two different days. So you might see some events coming up in the fall where you're doing an educational event, and then they announce the next session will be a sales event where we can actually get you guys submitted for specific Medicare Advantage plans or supplement plans. So that's a nice caveat that's changing. Prescription drug prices are going down for a lot of the big names out there, but obviously there's a couple of things that we could do to mitigate those costs. Craig mentioned the Canadian pharmacy. We have resources to connect you with that. The other thing is GoodRx. Sometimes it's better to go through GoodRx for a discount versus going through your insurance company. So I usually do, tell my clients that. GoodRx is free to use. It's an app that you can get on your smartphone. You just show it to the pharmacist and you get that discount on the prescription. So definitely get with an agent like myself who can walk you through all those scenarios, get you the best plan, get you the best coverage, and help mitigate your costs. That's what we're here for. And again, we're not paid by you. We don't charge you. We're not allowed to. For Medicare. So we actually get paid directly by the carriers, and it's the same amount. So we don't have a bias towards any carrier. So just keep that in mind as you're shopping around agents. So that is it on that. I know Johnny's about to come on in a couple of minutes. He's our second guest. I don't know if he's on or not. If he's not, I will continue talking because I can do that. Oh, there we go. Hey, Johnny.
I was watching you guys, man. Your industry, it seems very complicated, man. Like I can't imagine being in your consumer's position and having to manage and go through all that stuff. I was listening to you guys for a good minute. I mean, it's crazy how complicated that could. It is,
and it sucks. It's the regulations change every year, and we have to keep on top of it. And our consumers get confused like heck. I mean, it's like everything changes every year, right? And so they're just like, what is going on? So that's kind of what we're here for. But obviously, we get overwhelmed by all this too. So
sure, yeah. Well, you guys are probably the best ones to talk to, right? You're staying abreast on all the new stuff coming down the pipeline. A guy like me has no idea.
All right, man. Well, hey, I'm so glad this is the second time you've come on. I'm going to pull up your information here. Give me 1 second. But give the audience a little snippet of who you are if they haven't seen you before.
Yeah. So my name is John Alanya. I am a realtor here in Southern California. I primarily service Riverside County and surrounding areas. Been in the industry for 8 years. I'm actually in the process of renewing my license for another 4 years. So I'm definitely doing this for another 4 years.
Nice. Well, I'm glad you're not going anywhere.
Yeah. So that's the basic gist. I thank you again for having me on the show again. The first time was a lot of fun and excited to do this with you today. So
yeah, we're hoping we're kind of doing some new things with our show. We're creating viral clips and showing it off our socials like TikTok and whatnot. So hopefully we get that information out to you. If you guys don't know, Johnny helped us buy our first home out here in Chino. So he's the man. He is a wonderful person inside and out, really cares about the client and does wonders to get you the right place. He's not pushy. He's patient. And so I love that about you, man. But you did send us some questions to ask you. I know the market changes constantly. Interest rates seem to be still kind of inching up, right, on the mortgage rate side.
Yeah. So yeah, it's been a sticky thing. I mean, I think even last time we spoke, it might have been around when the Iran war might have started.
Yeah.
But yeah, so that kind of threw a wrench in everything because the rates were starting to trend down, and now they're at a pretty high level now again. And yesterday there was a conference going on, and basically the economist was saying like this market is the market. Like there's not really an outlook where things get all that much better than what it is now. And it's been like this for about 3 years. It's been about the same market for 3 years, high interest rate arena. And it's just, people are like, oh, I'm going to wait for the crash. Well, people have been waiting for the crash, honestly, since I started in 2018.
Jeez.
People were like, oh, there's going to be a crash in 2 years. We'll wait to buy then. And it just never came, and I don't think timing the market is really the right thing. It's more so of like what your specific situation is on how your finances are and if you need to buy a house. So the market definitely is sticking around.
Let me ask you this. Because obviously prices are so high, especially in California, right? Are there programs right now that people can kind of access? I mean,
yes and no. I mean,
okay.
Everybody always talks about the first-time homebuyer programs and, getting like down payment assistance, but those things come with caveats. They usually come with higher interest rates.
Okay.
So that's one thing. And that obviously affects your mortgage payment. And I think everybody that's buying a house, it's not so much the price of the house, it's how much you're paying per month, because that's part of your budget, right? So the way that I've been seeing it being managed in the recent times is generally buyers are getting closing costs right now. I mean, I feel like that's almost every situation that's happening. And those closing costs can be used to buy your rate down if it makes sense. Some people are opting to do like a 2-1 buy down where your interest rate's lower for the first 2 years. And then it ramps up to what it should be, from the initial, like the actual loan amount or the interest amount. But there's tricks on trying to get it better to get into a house. But the reality is like, first time home buyers paying $4,700 to over $5,000. And these are like young people, in their 20s, like just got married. And to me, that's crazy. But it is what the norm is right now. Unfortunately,
it is. I mean, that's one of us. That's us right
here.
I mean, and we got in right when, our interest rate's 5.25, which is unheard of now.
Oh yeah. See, like you're sitting on an asset right now.
Yeah, exactly. Yeah. Oh man. Well, okay. So are there certain places like new home builds that are better?
Yeah. Okay. So I'm seeing people going through new construction, and that's it. Well, okay, it's a double-edged sword. You get a good interest rate by going with their lender, right? Okay. So you might actually get like a 3.99, which is happening. Like some people are offering that, but then most new construction is going to have high tax rates. So you're getting cut off by the high tax rate. So it's almost kind of even in a way. If you find a house that's, just a resale home, that's regular tax rate, like what your house is,
right.
You're offset by that lower tax rate. So it kind of cancels it out, to be honest with you. I think that's why new construction is doing that. But it could work for some people, it just depends on the situation.
Well, it seems like HOAs are pretty high in those areas too.
And that too, it's hard to find a new construction without an HOA. They exist, but it's far and few between.
Yeah. Well, what's the biggest wins you've seen for your clients this year?
Okay, so I wanted to share this because I was so excited about this. I just closed with a buyer less than a month ago, and it was a multiple offer situation. But to make the long story short, we ended up getting them $18,000 in closing cost credits.
Wow!
And the appraisal came in $30,000 over what they offered for the house.
Oh my gosh.
So they scored, dude. And I'll be honest, I haven't seen that in a long time. Like the last time I think I saw a huge gap in the appraisal was probably 5 years ago.
Okay. Okay.
30 grand is a lot, dude.
Yeah, that's crazy, man.
Yeah. And it's like, of course, we don't tell the seller that because we actually negotiated more of that closing costs after we already had that number. And it was just because of repairs that we were wanting to get for the house. So yeah, 18K and 30K over appraisal. Like, I was like, dude, that's a win, bro. I had to share that, dude. I was
that's awesome. That's awesome.
Not a common thing.
Those owners must be ecstatic, right?
They are stoked, dude.
Yeah.
100%. Yeah.
Wow.
Yeah.
Wow. That is unheard
of. But anyways,
right.
I guess to kind of carry on with that is I think a lot of buyers are getting closing costs right now. So there's opportunity in this crazy market where people are like, I don't want to jump in, but it's like, dude, there's opportunities out there right now.
Okay. Okay. Well, that's good to know. I mean, because it just seems like, you hear the reports, everyone seems pessimistic. And I'm like, but houses are still being bought. I mean, obviously something's being done.
That's what sells though, right? Like if you put this podcast out and said like, Medicare's falling apart or whatever, like people are gonna be like, oh, I need to watch this. Like what's happening, So I think the scary stuff, like the scary news, the headlines, that's what grabs the attention, but that's a marketing ploy, man. I really do. I feel like people are going for the views. I still feel very confident that pricing is going to stay pretty steady. I'm not seeing a super low drop and I'm not seeing like a super like high increase in pricing. I think it's going to be very steady because of the market. It's just, it's a slow moving market right now. The volume's down. So without volume, you can't see a huge jump one way or the other.
Okay. So where do you see the market going? Short term, long term?
Short term, I've always said this, dude. There's opportunity in the wintertime, man. Like if someone is like, if there's someone out there that's like, oh, I'm waiting for the market to crash, like every winter, like start looking for a house in October because once Thanksgiving and Christmas comes around, a lot of people don't jump into the market. They're busy with family. They're busy managing the holidays. And I've always seen the best deals for my clients in December to January, best times. In fact, personally, me and my family are in the market for a home and I'm basically waiting till then to start looking. Like we're always looking. We're always looking, but that's the time for me. I'm jumping in around that time. That's when we're going to start really heavily looking. Cause I know that that's when the deals happen.
Well, congrats. I know you guys are looking for a bigger place. So that's,
we are. Oh, absolutely, dude. Absolutely. Yeah. And then long-term, I think it's going to be a very steady market long-term. The thing is like, we actually did put an offer in on a house earlier this year.
Okay.
But then we just decided I had too many projects going on because we're going to keep our house here. I had a project going on outside that I was dumping money into. And then the new house that we were looking at needed a bunch of work. Okay. And I was like, man, I don't know if I could manage 2 large projects at once. We just decided for our family, it was like, okay, are we adding stress to our lives or is this going to make us happy? And we chose happiness, dude. And that was not going forward with the house, Awesome. And so I share that story because even for me, like I am literally in the market with my buyers and my sellers. And for us, like I was like, it's okay to wait because I really don't think pricing is going to go up so much next year that I'm like, trying to buy the market now because price is going to go up. Like I'm okay waiting till next year. I really am. So that's my mentality. And I pass that along to any, future buyer that's thinking about doing something. Like waiting's okay. Like if you need to.
That's good to know. Cause we were looking at doing construction here. We're thinking of doing like a small addition, but the costs are so expensive. I'm like, it might be better just to buy a home.
It is. And the thing that people don't think about is you do an addition to your home and like I'm locked in on a really good property tax rate, right? Cause it's locked in at what your price that you pay for your house and it only goes up a certain amount per year. And the second that we do anything here where we add square footage, it could potentially re-trigger another reevaluation of our property taxes. And I just lose out on that. So that's something to think about that, I don't think most people do think about that, but it's an added cost, right? And that's going to be something forever.
That's right. So, I didn't even think about that. No,
that's
a good point. Well, I might be hitting you up next year. We'll see how things. Business is going really well, and
that's good.
We need a bigger space as well. So
yeah.
All right. Well, so long term, do you think you think these interest rates are here to stay? You think?
I personally don't think we're ever going to see like 3% rates for a while, if ever. Okay. I don't know, dude. I'll be honest with you. Like I'm okay with saying I don't know, because the fact of the matter is, like, even the MBA, Mortgage Bankers Association, those guys are the pinnacle of like economists when it comes to interest rates. And even them, like they made so many predictions in the last 3-4 years that were completely wrong. Okay. So, I mean, I don't think anybody knows. I think it's just one of those things where it's like, you got to just kind of roll with the punches. But for interest rates, yeah, I don't see them going super low. I mean, I think they're at where they're at, and maybe we'll touch in the 5s. If we got in the 4s, I'd be surprised. And that would be like, but here's the thing, rates go down, home prices go up. So it's like, choose your poison.
That's true.
You know what I mean?
True.
Choose your poison. Yeah. It's going to be one or the other.
So what kind of things, like, I know you probably touched on this already, but what kind of things do buyers need to look into specifically if they want to enter the market right now?
I would say it's never too early to explore your options with a lender. And that's really the first stop. Like, I get phone calls all the time. They're like, hey, we're looking to buy a house, and you're our first stop. But the reality is, I'm not the first stop. I might be the first stop to direct you where to go. But the reality is, a lender is the first person, because I don't care what you say, dude. Everybody's decision-making is based on the budget, and you don't know your budget until you talk to a lender. So talking to a lender is free. There's no cost. Right. You're not committing to buying anything. We're not going to bug you. Like you harped on, like, I'm not pushy. I've ran my business like that forever. It's like, I hate going into a store and like right away, like, oh, how can I help you? I don't want help right away. I just want to look, So I kind of run my business the same way. It's like, I'm here to help, but I'm not going to be pushing on you. But yeah, with a lender, like, there's no obligation to move forward. It's free. You talk to them, they run the numbers with you. Maybe it makes sense at the time, maybe it doesn't. And if it doesn't, then cool. They'll give you a game plan, like, hey, you got to increase your income, or you got to pay off some debts. But either way, you're going to have a route to take to get to the point of being able to buy a house. And that's what I would say for any buyers. Just see what you could do. It's free. Okay. It takes a few minutes, and that's it. And then you can decide from there.
Well, I'm gonna kind of pivot a little bit and ask you a question about just real estate in general. I've got some friends who are looking for a job, and they always ask me, how to become a Medicare broker. Obviously, the conversation also goes to real estate. It's tricky. I know. It's just like our market. It's up and down. Some months are really good and some months are not. How do you navigate that? What would you tell someone who you might be grooming to become a real estate agent? Things to look for?
Oh boy, I would say that's a great question. I think it's more about mindset, and I think we even touched on this last time. Like, real estate's not an easy industry. I'm a mentor within my brokerage, so I have mentees, new people in the arena that surround me, and I see the struggles that they go through. And like, thank God I got into the industry when I did. I mean, I still say to this day, like, my success has been a true blessing from God on how it's the trajectory, how I've been able to maintain relationships with my clients. Like, if I didn't get that base and then get all these referrals, I probably wouldn't be in business. I mean, that's the truth.
Right. Yeah.
So for anybody new getting into the industry, I would say you have to have thick skin. You don't fail unless you give up. Right.
Okay. Right.
So if you keep pushing, you eventually will get to a successful point in your career. The time that you fail is when you give up. And that's the only thing I could say, because I think a lot of people get into the industry thinking like, oh, I'm going to join a brokerage and I'm an employee. Like, I'm just going to get leads handed to me. That's not how the industry works. Like, you're literally starting a business. So, you need to go into it with a business mindset that you're growing your business from zero to something more.
Now, are there any certain companies they should be looking at? I mean, obviously you're going to be biased a little bit.
Yeah. No, you know what? When I first got into real estate, I started with a brokerage that gave me zero guidance, and that lasted for like 3 months. And then luckily I met somebody that introduced me to one of the first brokerages I was at. And the first thing they did was they stuck me in like a 4-week training program, which I don't even know if you could really find that anywhere. I'll be honest with you anymore. But if anybody's looking to get into a brokerage, it needs to be one that is going to hold your hand and show you how to do the business. And yeah, I mean, yeah, sure, I'll be biased. Like the brokerage I'm with, eXp Realty, they set you up with a mentor when you start. So as long as you get a good mentor, you'll be taken care of. And every mentor is going to be different, right? Because I think everybody runs their business in a different fashion. Like there's so many ways to run a real estate business. It just depends on the type of person you are. But yeah, I would say picking a brokerage based on the instruction and based on the education is probably the best choice. Not your split, not how much money you're going to keep after you close a deal. Like that to me is secondary. You need to learn the business first, and then you can worry about maximizing your profit as a business owner.
Okay. Oh, well, that makes sense.
Yeah.
Well, hey, Johnny, man, I appreciate your time today. I mean, it's been awesome to have you back. Johnny's a good friend of mine. So any questions that you have about becoming a real estate agent, or you're looking to enter the market, you've got the information there. Scroll in. His phone number is right there, 909-821-2781. Is that the best email address for you, Holmes@John?
Yeah, it is. Yep. That's my best email. And if you want to find me online, if you search John Olanya Realtor, I pop up.
Awesome.
So,
awesome.
Yeah.
Well, thanks, my friend. I appreciate your time.
Yeah, I appreciate you too, dude.
All right. You have a great morning, and we'll talk again soon.
100%.
All right, man. Take care.
Bye-bye.
Bye. All right. That was our good friend, Johnny Olanya. He's been in this industry for quite a bit of time, and he's got some great things to share with you. So if you need to reach out, you're looking to enter the market, like he said, I mean, this market is pretty steady now. It's not going to really go up or down as much as people think. Unfortunately, these interest rates are going to stick around for quite a while. So if you're looking to enter, then definitely reach out to him if you're out here in Southern California. I'm going to share one last thing before we close out. Hopefully I can do this really fast. If not, then we will see if I can do this next time. Okay, let's see here. Ooh, this is easier than I thought. Okay, so I'm going to try to. Perfect. All right, so this is our website, josephinsurancebroker.com. We just got a new article published on us. You can go to our homepage and read that article. It's from Voyage LA, so I'm just going to click this. And if you look, this is an awesome article about us. We are out there. We are making an impact in our community. I love the fact that our story is being shared everywhere. So I highly recommend you read this article. Just kind of the couple of tidbits. It talks about our radio show here, our podcast that we do weekly. So we're trying to get the word out. We do Medicare 101s all over the place. So if you always go to our website, there'll be information on what we're sharing. So I just wanted to share that little story with you guys. So hopefully you guys all saw that. If you're on a podcast and hearing the audio, just go to josephinsurancebroker.com. We thank you so much for listening in. We thank you for our supporters, our sponsors. At the end of our show now, you can see a list of our sponsors that have been on our show, our guests, and we appreciate all of you. We wouldn't be here without them. And so I appreciate all the support we've gotten from our past guests. If you want to be a sponsor, just reach out to me through Facebook. We are on Facebook Live. We're on our YouTube channel, Medicare Minute with Peter. That's our YouTube channel. So check us out. Thank you so much. And we do this because we Medicare.
Thanks for listening. Tune into Medicare Hour and more with Peter every Tuesday at 9 a.m. Pacific Time right here on K4HD Radio at k4hd.com for more real-life stories from experts who Medicare about you and protecting your health, your finances, and your future. See you next week.